Hello and welcome to this special feature. Now, every life is invaluable and precious. When medical emergencies like cardiac arrests happen around a person, it's so important to be prepared. You can help someone in a medical emergency when you're clear about what needs to be done in these situations. And for that, it's very important to be well informed. Worldwide, millions of people die of sudden cardiac arrest every year, and this is partly because of limited and sometimes ineffective bystander CPR or cardiopulmonary resuscitation. Many adults in cardiac arrest can in fact be revived with neurological functions intact if bystanders were able to intervene and provide immediate CPR, which is why it's so important to raise public awareness for CPR and just how to provide it. Save a Life is an initiative through which people are made aware of the early signs and symptoms of cardiac arrest so that patients can be taken to hospital in time and given trained CPR. As always, we're joined by medical experts to talk us through these important processes and techniques. Dr. Nivedita Kher, Director of the Rudved Heart Clinic, Dharampet, Nagpur, is with us today. And Dr. Sumanta Chatterjee, Consultant Cardiologist with AMRI Hospital in Kolkata, also with us. Let me begin with Dr. Kher. Cardiovascular diseases seem to have become the leading cause of mortality in India, Dr. Kher. Why are Indians just so prone to cardiac diseases, cardiovascular diseases? What's different?
Yeah, it is very true that you can say silent epidemic of cardiovascular diseases is going on in India. Like other South Asian countries, India is also genetically prone for cardiovascular diseases. Then Indians also have many cholesterol problems. In the sense, they tend to have higher levels of LDL cholesterol and lower levels of HDL cholesterol. Lower levels of HDL cholesterol is very harmful for our body, and it tends to cause atherosclerosis in coronaries and carotids, which are important arteries of our body. India is said to have diabetes capital in the world because 1 in every 5 people in India is getting diabetes nowadays. Diabetes is important cardiovascular predisposing factor. Then more and more Indians are getting hypertension, that is high blood pressure nowadays, and it is adding to the problem. In Indians, as they approach middle age, their abdominal girth increases. Increased fat deposition in the abdomen area is important risk factor for cardiovascular diseases. Our new population is having now more and more having processed food. Their lifestyle is sedentary. They don't tend to exercise much. These are also predisposing factors for cardiovascular diseases in young population. Along with, they are going more for smoking habits, then more excessive consumption of alcohol. These are the traditional risk factors. 3 more risk factors have emerged in India in the recent survey. These are hyperlipoprotein A level, hyperhomocystinemia, and more CRP levels. So these are the 3 new modalities which are telling us that cardiovascular diseases is more prone in India. Along with that, during COVID and post-COVID period, stress and depression in our population is also letting more blood clotting, leading to thrombosis in the arteries in the body. So to sum up all, these factors contribute to increased cardiovascular diseases in Indian population.
Right. Thank you, Dr. Kher, for that. Dr. Chatterjee, what do we do to prevent this then? Can a healthy lifestyle such as regular exercise and nutritious diet actually help reverse heart disease or reduce the risk of developing it in the first place? Dr. Chatterjee?
Yeah, sure. Definitely. This heart healthy lifestyle are having 3 prongs. Number 1 is healthy diet. Number 2 is exercise. And number 3 is meditation or offloading your stress. So the diet, healthy lifestyle means healthy diet. Healthy diet means I mean, more than 3 liters or more than 3.5 liters of water. Avoid smoking, avoid excessive alcohol. I mean, multiple times food with lesser quantity of food, less amount of sugar, lesser amount of salt, increasing amount of potassium and micronutrients, colored fruits and vegetables. Uh, Next, stress buster or offloading stress means meditation, pranayams, yoga, and having a good night sleep at night around more than 6 hours, more than 7 hours. And then exercise. Exercise means not that you have to do a gymming kind of thing, just simple 30 minutes a day, 5 days a week exercise, cycling or swimming, jogging or brisk walking, and with sweating. These simple exercises will do, and maybe with 1 hour of yoga or pranayam in a week. So this will do. This will keep your heart healthy. I'll not stick to the word reverse, but definitely they can prevent to develop your heart disease.
Right.
Specifically, if there is a family history of heart disease, definitely try out this thing. They can defer, they can postpone if these things are inculcated from your teenage.
Right. Thanks so much, Dr. Chatterjee. Let me also bring in Dr. V Rajendran, Chief Interventional Cardiologist with the Kovai Heart Foundation in Coimbatore, who joins us. Dr. Rajendran, cardiovascular or heart-related emergencies are common. They often cause deaths as well. So, if you could just take us through the common heart-related emergencies. What are these exactly?
Yeah, well, that one of the most common thing is the heart attack, we say. That is the coronary artery heart disease. That usually the blood vessel supplied to the heart, coronaries blocked with fat material. That is one of the common, that is the patient usually present with a chest discomfort, with fatigue, then sudden collapse, or usually call it as a sudden cardiac death, which is the most common cardiac emergency, is the immediate attention. Then second is the heart failure usually. The pump muscles are weakened and failure, usually present with the breathing difficulties, palpitation, and giddiness and collapse. This is the second cause, is the heart failure. The other thing is the hypertension, high BP, which cause the sudden cardiac death or collapse. And valvular heart disease. There is a valvular narrowing or valvular regurgitation that causes the heart failure and sudden cardiac death or cardiac emergencies.
Right.
Then other rare thing is the cardiac arrhythmias, usually the irregular heartbeat or fast heartbeat. That is the ventricular tachycardia or ventricular fibrillation, atrial fibrillation, or heart block. We call it a complete heart block. Such all will cause the life-threatening cardiac emergencies. We need the emergency care.
Right. And Dr. Kher, what are the existing heart conditions which can lead to a sudden cardiac arrest? Dr. Nivedita Kher?
Yeah. So sudden cardiac arrest differs, the etiology differs in different age group. In young age group, that is around 30 years or young people, the cause of cardiac arrest is usually arrhythmias. Arrhythmias is abnormality in the conduction of impulses inside the heart. So there are many conditions which run in family, like WPW syndrome, Brugada syndrome, long QT syndrome. So in these patients, they may primarily present with sudden cardiac death. Then there are structural heart diseases which are present since birth. There could be valvular heart diseases like rheumatic heart disease. There may be inflammation of myocardium, that is viral myocarditis. There may be abnormality in the electrolytes such as hypokalemia or hyperkalemia. In young boys who play, there could be a heavy blow of ball like football or baseball over the heart that can lead to sudden cardiac arrest. There could be cocaine or amphetamine addiction in young people that can also present with sudden cardiac arrest. So these are the important causes of sudden cardiac arrest in young people. in elderly people, that around 50 to 60 years of age, the cause of sudden cardiac arrest mainly is coronary artery disease in the form of angina or heart attack. It is the most important cause of sudden cardiac arrest in elderly. Second major cause of sudden cardiac arrest in elderly is heart failure. Structural heart diseases, valvular heart diseases, many cardiomyopathies like hypertrophic obstructive cardiomyopathy or dilated cardiomyopathy can also lead to sudden cardiac arrest. Then there could be, as I said, electrolyte imbalance, hypokalemia, hypocalcemia, hypomagnesemia, hyperkalemia, then hypoglycemia, that is fall in the blood sugar levels, that can lead to sudden cardiac arrest. There could be pulmonary, that is related with lung diseases, causes of sudden cardiac death like tension pneumothorax or clot in pulmonary arteries. So these are the various causes that can lead to sudden cardiac arrest in the population.
All right, a very comprehensive answer there. Dr. Chatterjee, if I can bring you in, remembering the steps of CPR and administering them correctly can sometimes be a challenge. If you could just run our viewers through the correct sequence of steps for CPR, Dr. Chatterjee.
Sure. It's a very pertinent question. So what are the exact steps of CPR? So first of all, every person should be aware and should be educated that these are the steps of CPR. First of all, scene safety. Number one is scene safety. You see what is the safety of that person and yourself where this thing is happening, be it in the road or in the train, in the bus. Scene safety. Next is shout and tap. You just have to have the confidence that patient is not responding, whether the patient is responding or not. These are second step. Third is move that person or have a flat, hard surface to begin the CPR. Next, you inform your friend or police or ambulance or nearby emergency services or your emergency number or your hospital that I am going to give the CPR. Please bring a trained personnel or AED defibrillator or inform ambulance. Next, start the proper CPR, that is chest compression. You put your fingers, put your fist in the center of the chest and start compression. Compression should be rapid and forceful to depress the chest wall by 2 inches and then have a rest for that to recoil. So rate should be around 100 to 120 per minute. 30 chest compression should be there. So this is the optimal one. Then 2 breathing should be there. Mouth to mouth breathing to have, air should go in and the air should go out, and then the next cycle, each cycle should for 1 second, the 2 cycles of breathing, and then again you repeat the 30 chest compression. The chest compression is very much important because if anybody is, don't want to give the mouth to mouth breathing, he can skip that part. Only chest compression, only CPR is there. You can do that only, and then again you should wait for trained personnel to come or AED to come. Until that, you repeat the cycle of 30 chest compression and 2 cycles of breathing. This is the steps of CPR.
Right. Dr. Rajendran, will chest compressions alone bring a person back or restart the heart? How does the victim get oxygen with chest compression only CPR?
Yeah, while giving the chest compression, the mainly left ventricle is compressed and they inject the blood into the aorta. Usually they have minimum aortic pressure is maintained to have the full circulation, particularly the blood flow to the sensitive organs like brain, the kidney. These are the most affected while any delay in getting the oxygen. So the oxygen is supplied to the blood circulation is maintained. While giving the compression, blood is ejected, and then minimum aortic pressure is maintained to have the full circulation to the vital organs, particularly the brain and the kidney, get the oxygen.
All right. Thanks very much indeed. We will take a quick break at this point, but there's lots more to talk about, including what to do if a person has recently had open heart surgery. We'll be back in just a moment, right after this quick break. Welcome back. We've been talking to medical experts about cardiovascular diseases and what to do in the context of sudden cardiac arrests. Let's go straight across to Dr. Kher. Dr. Kher, what if a person has recently had open heart surgery? Couldn't chest compressions actually even break the chest bone?
Yes. In patients who have undergone chest surgery recently, the treatment option differs. Because if you give chest compression over these patients who have recent sternotomy, that is the suture along the sternum, there is chances of bleeding. But fortunately, these patients are generally admitted in ICCU or in the recovery room. And monitors are attached to these patients. Ventilatory support is available, defibrillator is available. So if a medical personnel, say a doctor or a nurse, watches abnormal rhythm over the monitor and the patient is symptomatic, immediately the resuscitation measures are started. And in these patients, DC shock is given. 3 cycles of DC shock are given at the difference of about 2 minutes. First and second DC shock are of low amplitude, about 150 joules. The third DC shock could be of 360 joules. Along with that, many antiarrhythmic drugs like Cordaron are started simultaneously. If the monitor is showing bradyarrest, then the treatment option is pacing. Pacing wire are inserted into the cardiac chambers and the pacing, artificial pacing is given. Along with that, high doses of atropine are administered. Along with that, airway circulation is monitored. Endotracheal tube is inserted. If it is already there, they look for the proper airflow through the endotracheal tube. And FiO2 100%, that is 100% saturation of saturated oxygen is given to the patient. Along with that, many other drugs are started according to the patient's condition, and the trolley should always be ready for re-sternotomy procedures in these patients.
Right. Dr. Chatterjee, one of the things that can make someone hesitate in a cardiac arrest emergency is fearing legal repercussions that could be involved in getting involved or trying to help. So what is the legal position on this? Is CPR legal in India?
Oh, yeah. So there is no solid legal frameworks in India. Definitely, ICMR is saying that out of hospital CPR is not the default one, but definitely one can opt in and opt out. So no, here you are a good Samaritan. So definitely, if there is a cardiac arrest, if the things are going on, then definitely you should do. You should do it. But the foremost thing is that in grassroots level, in mass level, awareness should percolate. Everybody should be educated that these are the steps. Why to opt out and why to opt in. So first of all, these are the first things. Everybody should be educated about the CPR. Then only these legalities will come. Their legality issues will come forward. But anyway. If your intent is good, you are trying to help, that there is no options like this legal issues. In abroad, in US, in and UK, in every state, there are good Samaritan law. In individual state, good Samaritan law is there how to go for this thing, but they can never be sued. Regarding your bone breakage, there is an issue that you can do a CPR and there is a breakage of your bone. So, but breaking a bone is better than losing a life. So in that case also you will not be sued regarding this thing. So in our country where more than 10,000 population die per lakh, CPR should be percolated in grassroots and mass root level, right, and without any legal fear.
Okay. Dr. Rajendran, how does an automatic external defibrillator or an AED help a person who's in cardiac arrest?
Yeah, well, there's automated external defibrillator is now available in a simple and safe device. In addition to CPR, we are using this. This additional medical device definitely saves additional more life situations, particularly the sudden cardiac death due to ventricular fibrillation, ventricular arrhythmias. So it is been previously it was mostly available in the hospital, but now it is being more and more available in public places like malls, theaters, and even public places where people gather. So it is been better to handle it with the trained people. Even now, the bystander, companion, educated people, very simple to even educated people can handle it. Definitely gives a shock when there is arrhythmias, particularly ventricular tachycardia fibrillation. So it is definitely a useful one. Should be more and more should be available in the public places, and more and more volunteers trained, because I think the fear of that either we do harmful person. So that fear, once we train more and more volunteers using AED in addition to CPR, particularly with sudden cardiac death due to arrhythmia.
Right. Dr. Nivedita Kher, when is there a need to do an angiography, and what exactly is this procedure, if you could explain to us?
Okay, so when patient approaches a doctor and he tells about his symptoms, whether he is getting chest pain or breathlessness, or if the pain, what type of pain he is getting, heaviness, constriction, or radiating pain towards jaw or shoulder. This is a typical anginal pain. If the doctor feels that the patient is having typical anginal pain, he will advise the patient to do angiography. If he feels that the pain is atypical, he may reassess the patient with some indirect test in the form of treadmill test. If the treadmill is positive, it is positive for inducible ischemia, then again the doctor will advise the patient to do coronary angiography. So what is coronary angiography? Coronary angiography is the procedure in which the coronary arteries, which are the main arteries that supply blood to our heart, are visualized under fluoroscope. And to visualize them more properly, a dye is injected at the entry of coronary arteries. The catheter and guide wire are inserted at the entry of the coronary arteries through radial artery or femoral artery. That means the artery in the hand or artery in the leg, and the dye is injected. When the dye is injected, you can see the dye and flow through the coronary arteries, and if there is blockage of the arteries, which artery is blocked, at what is the percentage of the blockage is assessed is assessed, and if the blockage is very small, then only medical therapy can be advised. If the blockage is significant, that means it is more than 70% of the flow, and the flow is obstructed and it is causing angina to the patient, then other options like angioplasty, that is opening of that stenosis with the help of balloon and putting a stent at the site of stenosis, so that the blood flow is again normalized through those coronaries. It is called as coronary angioplasty. That can be done. If more than 2 arteries are involved, or if the left main is involved, or if the stenosis is such that it is very distant so that the catheters cannot reach over there, in that case the doctor can advise you for CABG surgery, that is bypass surgery.
All right, Dr. K, thanks so much for giving us those very comprehensive answers. Thank you all for joining us on this edition of Save a Life. Thanks for watching.